My name is Llewellyn Padayachy. I'm a pediatric neurosurgeon, which means I operate on children who have brain tumors, children who have a condition called hydrocephalus, which is a buildup of fluid in the brain. A lot of patients that we've seen had gone to a whole array of doctors over a long period of time. So what may have been at that stage a tumor that was the size of a pea in the child's brain, by the time they get to you is the size of a tennis ball. It's always a case of, could we have diagnosed that earlier? And the one sort of consistent feature is this diagnosis of raised intracranial pressure. So apart from the clinical assessment, the gold standard involves drilling a hole in the skull and placing a catheter into the brain to actually measure this pressure. So a non-invasive tool to diagnose this pressure is exceptionally appealing. And in neurosurgery, it's been called the holy grail for many, many years. The difficulty is the brain's encased in a thick, bony skull, so it's inaccessible. And the only natural windows to the brain are the eye, the ear to some extent, and then the spinal cord. Whereas the eye is directly linked to the brain. So you could get a whole array of information from the eye that gives you information about what the state of the brain is. So the technique itself involves placing a high-resolution ultrasound probe, a little bit of gel over the eyelid, and scanning in the correct plane. And initially it may require some sort of technical expertise, and if you don't know what the anatomy of the eye is or the sheath, it's a bit difficult to interpret those kind of things. So the whole drive behind Nisonic and the goal is to simplify that process. So a nurse or a nurse practitioner or anybody functioning in the clinic at that level could do a very simplified scan of the eye. So the benefit of a tool like this is it will help us to streamline our diagnostic process in terms of who actually needs these procedures and who doesn't.